Okay, so what we're going to do now is we're going to talk about headaches. And I'm going to talk about mainly about three types of headaches, and this is just an overview. So the first type of headache is a tension headache. This is the most common type of headache. This affects about 85% of people. It affects women more than men. And basically, it's just a headache that starts in the back of the head and works its way around. It might feel like there's a tight band around the head. And a lot of times when people have these type of headaches, they want to just rub their temples to try to get the muscles to relax because it feels like it's a muscle tightening around the head. It can be mild to moderate, and they can last. Research says 30 minutes, but they can be hours at times. They can be often or rare. Also, there may be throbbing with these. Normally not. You're going to see that more with a migraine headache. The thing about these two is usually not visual disturbances. You're going to see with migraine headaches, light actually bothers it, and with a tension headache, usually light's not a problem. So migraine headaches, they also affect women more than men. They can be something that's common or more rare. Everyone gets one at one time or another. They're due to nerves causing inflammation and swelling of blood vessels. This should say around the brain, not necessarily in the brain. And what happens is the blood vessels will actually constrict, and then so the blood supply to the brain is actually being cut off a little bit, which will cause a prodrome in which people will start to either see weird things, get tunnel vision, have weird feelings, but they know that the migraine's coming on. And then the blood vessel opens up, and when it does, that's when you start to get the headache. And there's usually a throbbing, and you get pulsating pain. These are, like I said, these are usually on one side of the head. With these, people usually just want to go into a dark room. Sound bothers them, light bothers them, and they usually want to just go into a dark room and lay there. You can get vomiting with these also. The reason being is sometimes the body doesn't know what to do. It's because the pain is just real bad, so it tries to make you vomit. And like I said, usually people just want to find a dark, quiet space to just go and ride this out. Research has shown that these can be due to several different reasons. Hormone changes, foods such as chocolate, unfortunately, may cause this. Processed foods, salty foods, they may all cause this. Or they may just be something that's genetic and they come and go. Caffeine can help this sometimes. So I know one of the medications they used to give was called Cafagot because it contained caffeine. And then you have cluster headaches. This would be the last type of headache. This feels like someone's taken a poker, a hot poker like you use in a fireplace, and stuck it in your eye. These are usually seasonal. Like it says there, they can come and go. That's why they call them clusters. They come in clusters. So you get them for a while, and then they go away. And like I said, they're seasonal. So they're usually going to occur about the same time of the year. Okay, and then, like I said, I don't have the slide on it, but normally what will happen is this will feel like someone has taken a hot poker and poked it into your eye. With these, people also have a tendency to want to get up and walk around. They don't want to just stay in one place. And I don't know why it's not showing you the rest of my slides, but anyways, but that's mainly what it is that people want to get up and move around, and they're active with these. So some points that are not on the slides is I want you to know it feels like a hot poker has been pushed into your eye. People want to get up and walk around. And also, there's medications to treat this. Okay, and so that basically finishes the musculoskeletal chapter.